Thank you to the presidents of the Congress for having accepted this long-term distance lecture from my university. I am Professor Palmieri. My name is Benjamin Palmieri, and I am a staff surgeon at the University of Modena Medical School. And the presentation today is an intriguing nutraceutical approach in dogs affected by keratoconjunctivitis sicca. This is a quite nice discussion about the relationship between animals and human disease and a potential therapeutic approach to this disease by means of nutraceutical food. As everybody knows, keratoconjunctivitis sicca is a corneoconjunctiva progressive inflammatory disease affecting either human dogs with tears production, impairment, and several ocular symptoms triggered by autoimmune imbalance. Now, the current therapies, either in humans or in animals, are cyclosporin as immunosuppressive and anti-inflammatory agent, tacrolimus ointment with the same purposes, and artificial tears just for irrigation of the cornea, preventing ulcerations. Steroid drops are an either functional treatment locally dropped into the conjunctiva and can help to reduce inflammation and symptom. Our work aims to evaluate complementary role of 2 months administration of nutraceutical food in dogs whose immunosuppressive treatment had proven inadequate. The study was done at IRMO Center, which is a network between our university and vet institutions in order to perform physiological and pathophysiology studies comparatively between pet animals and humans. We have done since 10 years our studies in genomic and proteomics comparing pets and humans. IRMO is a network where comparatively we study oncology, inflammation, and neurodegeneration physiopathology, health maintenance, nutrition, prevention, and treatment. We have also a specific focus on oncology with pet animals as sentinels of human disease and potential recognition of health imbalances, especially in old, sick people. Specifically, we match animals and humans on a common pathophysiological and therapeutical basis, and furthermore to comparatively explore the human-pet common background for more effective strategies in human health and disease, because both humans and pets are exposed to the same environmental risks, so it is very easy and very challenging to compare the physiopathology of this disease and the therapeutics issues on this basis. We performed a study on 49 dogs of different breeds, mean age 6.01 years and mean weight 35 kilos, and equally subdivided between males and females with immune-related keratoconjunctivitis sicca symptoms, blepharospasm, mucopurulent ocular discharge, conjunctival chemosis and hyperemia, exposure keratitis with opacity appearance, vascularization, and corneal pigmentation, were supplied with a regular amount of nutraceutical products named Forza 10 immunophthalmic over a 60 days period. In this slide you can see that both eyes were involved in the symptoms, which were acute and chronic at the same time, and you can see that over the time there is a relief of the symptoms to single items. In this slide you can see conjunctivitis improvement in both the eyes. Also, the intensity of keratitis was reduced among the days of the treatment in both eyes, and corneal pigmentation was improved same time, same way. And also mucus discharge average intensity was improved as well during the nutritional program. And let's now see why these dogs improved so dramatically along 2 months treatment with food. what is the composition, the nutraceutical formula that we give to the dogs. Basically fish proteins, rice carbohydrates, melon superoxide dismutase, ascophyllum, astaxanthin, aloe vera, papaya, punica granatum, green tea, polygonum lapatifolium, curcuma, piper nigrum, zinc, omega-3, omega-6 ratio of 1.08. As you can see, this formula encloses a lot of vegetal extracts that are really useful also in human disease, but are not pooled in a single food. So this trial was very effective to demonstrate that pooling together different active principles can achieve very good results which can stay long term, and they are based on the fact that the basic substratum of the disease is modified by the synergy of different active principles. Let us synthetically examine now what is the human side of this nutraceutical food treatment. As you can see, we have to administer melon superoxide dismutase, which has strong antioxidant and anti-inflammatory properties, but also ascophyllum nodosum is used for different problems in the human, but has basically antioxidant activities and also anti-tumor to the activation of host immune system. And this is one reason why the infective part of keratoconjunctivitis can be dramatically improved by the ascophyllum nodosum integration. Astaxanthin is also an extraordinary inhibitor active principle of NFB-KB activation, which is a system which promotes inflammatory cytokines and intercellular adhesion molecule 1 in both messenger RNA transcription and protein synthesis. So this is the basic level of astaxanthin in the nutraceutical food that we use to control NFKB mechanism and TGFB1 induction. So in this way we are active on matrix metalloproteinase 2, and there is a quite a dramatic improvement of the anti-inflammatory effect. Aloe vera is another very extraordinary pool with anthrone, chromone, aloe verasin and hydroxyhaloin, and also power immunostimulants by polyglucan lactis, which significantly support the formation of specific and aspecific antibodies. Glucomannan and dasamannan, which are enclosed in the formula of aloe vera, accelerate wound healing, activate macrophages, and there's also antiviral and anti-tumor effects. Papaya has also strong immunomodulatory effects by reducing IL-2 and IL-4 production in PBMC, and also reducing IFN gamma and TNF alpha enhancement. And this is a very strong upregulation of different genes with immunomodulatory activity, as you can see in this table. Punica granatum is another herb with amelioration capacity in neuropathic pain, but also has a strong free radical scavenging, anti-carcinogenic and anti-inflammatory action, and is effective in treatment of cancer, cardiovascular disease, Alzheimer, arthritis, and erectile dysfunction. It has also alpha-glucosidase and maltase inhibitory effects due to the presence of 3-terpenes. So this is another quite complex mechanism of action which is putatively adopted in these experiments on the keratoconjunctivitis sicca. Also we have epigallocatechin from green tea, and this is a very well-known total antioxidant capacity and glutathione peroxidase inducing activity, which has been experimentally demonstrated on the Sprague-Dawley rats, and is also able to downregulate the cellular nuclear factor, erythroid-2 related factor 2, and upregulation of peroxyredoxin 6 expression. So there is a puzzling activity of green tea extracts as an antioxidant. Has a strong capability to pull the zinc into its leaves with significant inhibitory effects on Epstein-Barr virus and antigenic block. Curcuma also decreases inflammatory cytokine expressions in adipose tissue, but also have several different effects on the genes that you can see here, and downregulates also Th1 cytokine response and nitric oxide production by macrophages and their upregulation in natural killer cells. So there is a general immune modulating effect from curcuma. Piper nigrum has a complex formula of extracts with caryophyllene, limonene, cybenin, 3-carine, bipinin, and alpha-pinene, all endowed with antioxidant activity. And also the zinc regulates several enzymes and especially NFKB activity during innate immune activation. So also this molecule is very important in promoting wound healing, but also downstaging inflammation. And finally, omega-3, omega-6 ratio, which is in this case very well balanced, being 1 to 0.8 the ratio. This is very important for reversing endothelial dysfunction and oxidative stress in several models, including human menopause. And this idea of reducing inflammation by means of omega-3 has been generally adopted in several cardiovascular diseases and symptoms, and also in brain dysfunction. So let us see what are our take-home messages. First of all, humanization of domestic animals can be a valuable strategy for dietary intervention studies. Based on clinical evidence, humans and pets may have a very intriguing borderline mutual benefit in the functional foods area. Deletion of functional foods administration to the dog potentially might be addressed to human beings. Chronic food ingestion might in fact modify the genetic background and prevent or treat many diseases. But we have some possible gaps in human nutrition. The taste of the functional foods might be a drawback to their prolonged intake. In fact, the turnover of different menus is utmost appealing for human nutrition. Second, gut microbiota modulation by probiotics, prebiotics administration may reduce the risk of disease. And thus, food will be your medicine, accordingly with Hippocrates' aphorism. And we believe strongly that, especially in chronic illnesses, the integration with functional food might really improve the symptoms of maintaining the good level of healing achieved, avoiding relapses of the disease. So I am very grateful to the managers, the president of the Congress that accepted to input our lecture into this clinical, very important convention, just because we need to have animal models which are not reproducing the disease artificially, like injecting, for instance, inflammatory substances in the conjunctiva, rather are spontaneously observed by vets, and all the attempts to holistically treat the disease can be relevant also for clinical stage and clinical decision making. So I thank you very much, and I will give you my email, and Dr. Rinaldi, which is present at the session, can collect few questions and I can answer in real time to your queries. Thank you very much indeed.